So oftentimes there will be a section of pathology report that says positive for estrogen receptors or progesterone receptors or HER2 receptors. And they fail to look at the percentage of positivity. So positive can be 10% positive on the estrogen receptor scale. That does not mean that you are going to respond well to a hormone therapy. In fact, it means you probably won't. So I really encourage people to look at the percentage of the positivity that they have for that particular area of the pathology report. It's not just a yes or no question. It is yes and how much is positive for that respect. Something else that we see people make the wrong decision on is if their first test that they were given for a HER2 positivity, for example, is negative. They just stop with that. I'm HER2 negative. That's all well and good. I don't have the HER2 receptor. I told a story last week about somebody who still has a tumor in their breast, and they are a friend of mine and going through treatment. And on chemotherapy, the tumor is growing, and it's getting bigger by the day. So they went in and they did some additional testing and realized that the first test that they did for HER2 didn't detect a HER2. She actually is HER2 using a more sensitive test, GNFR test. So there's actually 4 different tests that can be used to detect HER2 positivity at a different level using some different technology there. So I urge people, even if you have a negative FISH test, which is typically the first test that they're going to use, beg your doctor, demand your doctor to do additional testing in that space. It can literally be the difference between life and death. These are cancers that are incredibly aggressive, require Herceptin, Tykerb. These are drugs that are targeted for the HER2 receptors. And in most cases, they're really aggressive chemotherapy regimen. So don't just take things at face value, ask questions. And like I said, be an advocate. You absolutely have to in order to stay alive in some situations.